everyone to today's event. My name is Jenna Groman. I'm the Director of Global Communities of Practice at the Sabin Vaccine Institute, and it's my pleasure to welcome you to today's session, Using Social Media to Increase Vaccine Confidence. Next slide, please. As we give everyone a moment to join today, please share your name, your organization, where you're joining from in the chat. And throughout today's session, we encourage you to share questions for the panelists and take advantage of the chat feature to share questions and engage with others on the call. Please, we'd love to hear from you throughout, both on your reflections on what we're learning today, but also sharing your experiences and how you've used social media as well. Next slide. The Insights Dialogue Project is an initiative of the Alliance for Advancing Health Online. The Sabin Vaccine Institute and the Bay Area Global Health Alliance are partnering to support the AAHO in its mission to advance public understanding of how social media can be leveraged to improve the health of communities around the world. Insights Dialogue is advancing this mission by first curating research insights on a dedicated microsite, sharing peer-reviewed evidence, resources, and tools for practitioners to use in their work, hosting the VaxUp podcast series, exploring community-led implementations of social media to drive vaccine confidence, as well as hosting live events such as this one in partnership with Boost, a global community where immunization professionals connect, learn, and lead. Next slide. And it's my pleasure today to introduce you to our moderator, Nuknud Lovu.
Thank you, Jenna, for that warm introduction. Good afternoon, everyone. From sunny Namibia, I'm Ngobizita Ndlovu, your moderator for the Insights Dialogues. Today, we're talking about using social media to increase vaccine confidence. And with me is an outstanding group of folks working at the coalface of this issue. Just an overview of our conversation and the flow. We will start with an overview of the Vaccine Confidence Fund report that was launched recently. And to answer the question of why the research is important, we have Channing Jiang, CEO of the Busara Center for Behavioral Economics. And shortly afterwards, Samantha Duse, Senior Director at Global Impact, will talk us through the report and the key insights and findings from the VCF report. That'll be followed by some reflections from our panelists that you do not want to miss. And finally, Aisha Kasali from Meta will close off our session with VCF2. What projects will be funded in that window, examples of interventions, and other details around awards. So you want to stay for that as well. And without further ado, let's start with the VCF report. Channing, I'm going to hand it over to you to talk us through the importance of this research. Channing?
Thank you. And welcome everyone to this really important webinar. I previously kind of pulled together some stats ahead of time to show you that social media is really pervasive. Nearly 60% of the world uses social media, goes on the internet, spends 7 hours there and 2.5 hours on social media platforms. But really, these numbers probably no longer surprise us or impress us. Everything is online. We're online right now. So beyond the ever increasing usage statistics, I really believe there are two ways that we should think about social media. The first one is that social media is media. Nearly all media becomes social media these days. And in many cases, media is first created, found, or shared on these social media platforms. I think today you'd be really hard pressed, especially amongst young people, to find those who get their current events or news from sources that aren't first on social media or on the internet writ large. And so understanding how this kind of media is produced, disseminated, consumed, and acted upon is really fundamental to our understanding of how this media is going to shape behavior, particularly for things as important as vaccinations and immunizations. The second thing that I want to share is that social media is really society. Social media has evolved It's a better real term for it is a digital society. People do so much more than sharing media on social media platforms. They hold identities, they form relationships and connections, they do business, they basically integrate their entire lives on online platforms. These societies are really unique. They cross multiple platforms, contain multiple identities. Who you are on Reddit is not the same as who you are on Tinder or on New York Times or on LinkedIn. And it's also important to remember that some of the very first people to use social media platforms, spaces, and the internet in general were oftentimes subcultures, those that are outside of the current status quo populations. Today, the internet is a melting pot for these less represented and marginalized populations. And critically, they may use the internet in interesting and unexpected ways. This is really particularly true for the newly digital across the world. A really stark highlight, a 2022 survey revealed that 42% of Americans use social media as a news source, but that number jumps to 82% in Kenya. So people are using internet in ways that we may not expect. And so that's why today it's really important to do the research that's necessary and share that research. We really want to find about valuable, specific, and timely research. Valuable because we need this for positive behavior change. As the internet brings new cultures and societies online and shapes current society, we need also it to be specific to the context of the people that live there. And then finally, timely. There's a quote from 2018 that 90% of the world's information was generated in the last 2 years. And so given the exponential growth of data and information, we need to ensure that our research is as responsive as the news cycles, memes, or subcultures that we're tracking. In sum, I'm really excited today to learn fresh, unexpected, and useful ways to leverage social media to solve vaccination immunization challenges. We need it now more than ever.
Thanks, Channing. I think, Sam, that's a nice setup for you to tell us some of the insights and findings from the report that you just published.
Yes,
Sam?
absolutely. Thank you so much. Yes, so my name is Sam Ducey, and I am a senior director at Global Impact. We're an Alexandria, Virginia-based nonprofit that works on charitable ventures to inspire greater giving, and we serve as the fund manager of the Vaccine Confidence Fund, or VCF. By way of background about the Vaccine Confidence Fund, in summer 2021, an open RFP, a request for proposals for the fund, was announced. We received over 280 applications submitted by individuals, organizations, and universities with research locations across high, medium, and low-income countries and across the world in sub-Saharan Africa, Asia, North America, Latin America, Europe. And in total, 33 grantees were awarded. So about 11% of applications that were received and over $7 million was dispersed to grantees with an average grant size of $220,000. In that research and across those grantees, 83% of the focus was on COVID-19 vaccinations and 17% was on routine vaccinations, with 3/4 focused on adults and 1/4 focused on youth. Tech platforms and methods included Facebook, WhatsApp messaging, chatbots, YouTube, Twitter, and Instagram, among others. And through that, we reached a significant number of people, these grantees and projects. So if we could turn to the next slide, we capture the scope of the insights report. Over 34 million people reached, 7 million engaged, and over 100,000 people vaccinated. This is from the work done by these 33 grantees, and in the report, we look to draw out key findings, detailed findings, and then also some next steps forward and other insights. So next slide, we touch on those key findings. So some of the key findings touched on customized messaging, successfully reaching populations, providing safe spaces and engaging trusted voices. This is across vaccine uptake and of COVID-19 vaccination, as well as routine vaccination. And each of the 33 grantees had their own unique perspectives and own unique learnings. And this is what was really drawn out from all of this work in terms of high-level findings. So messages tailored to the intended audience that saw a higher chance of resonating. We saw social media as an exciting way to engage people for the betterment of their health, along with many of the demographics that were studied, especially those that had been vaccine hesitant or in a position of responsibility, such as a parent for a child, looking to engage in online conversations in small trusted groups rather than in larger or anonymous spaces. And then also the importance of hearing representations of individuals in the communications that was key for many communities. So that may be customized in terms of language or cultural context. The detailed findings that we looked at and that are featured on the next slide touch on the findings from both routine and COVID-19 vaccinations. In this space, we looked at where there were, again, building off of the findings and different lessons learned, as well as across key populations. So we could turn to the next slide, please. These findings around vaccinations touched again on the importance of a tailored approach, the concerns around vaccine safety and a lack of trust that needed to be addressed within these research contexts, and then also specific messaging that was found to be most effective. A key element that's also touched on within the report is this idea of the changing context that researchers were working within. This research, as I mentioned, began in late 2021 and spanned into 2022. And as we all know from our own personal experiences and what we've witnessed, a lot changed within that period of time. And so researchers had to adjust their focus areas, adjust their messaging, tailor it to unique and evolving contexts. And that's reflected there as well, particularly across key populations. So those populations included healthcare workers, vaccine confidence questions around historically and excluded marginalized communities, vaccine hesitant populations, parents and children, pregnant and lactating women, and other adults. The report, and if we can flip to the next slide, also includes methodological insights, procedural insights, such as collaborating with trusted sources and engaging members of the communities, as well as individual grantee overviews for all 33 of the grantees that were awarded funding. And one of the key elements that was touched on as well, and that we hope this conversation will also build on, is the way forward. So community engagement and listening to needs of those communities, as well as how governments, health organizations, NGOs, and researchers can engage. So we encourage you to please visit the vaccineconfidence.org, a site which is also a link included in the chat to learn more about the insights from these 33 grantees and the path forward. Thanks so much.
Thank you, Sam. And as Sam mentioned, the report, the link to the report is on the chat. And as we proceed, feel free to chat our panelists on the chat box, and they'll respond to you live. And now we want to go into the meat of the report, look at some of the case studies, the projects that are covered in the report, and talking about trust, which features in something that Samantha said. Let me invite Emily to speak to us from the perspective of My Health Alliance, which is one of the projects that was featured in the report. We'll hear from Emily first, sorry, and then David from ILC, and then the Minority Rights Group, Sylvia and Al-Bashir, and then finally Sky from Oklahoma State. Emily, over to you. Talk to us about trust. Who do we trust in terms of messages and messaging?
Thank you. So good afternoon, everyone. I am Emily Lopez from My Health Alliance, or Wuhukawok, a nonprofit that works in rural Guatemala. So our project was focused on trust messengers and social networks in indigenous communities in Guatemala. Next slide, please. So our study team was very diverse. We had people from the University of California in San Francisco and the Stanford University, especially the Center for Health Education and Digital Medic, and UPSWell too. Next slide, please. So COVID-19 context in Guatemala, it's very interesting. Guatemala has a culturally diverse population, millions who identify as indigenous Maya, but the healthcare system in Guatemala, it's unprepared to solve this population well. As of May 2022, a little more than 1/3 of the population was fully vaccinated, and the rates were especially low among the indigenous communities in Chimaltenango, Sololá, Zacatepeques, and Suchitepeques, which are departments of Guatemala. Given these populations are at high risk of severe disease outcomes from COVID-19, we aim to better understand why these groups are not accessing COVID-19 vaccines and developing social media interventions to address these barriers. Next slide, please. So this is a timeline we built with the team that shows how the COVID-19 was being developed in Guatemala and how our project was being carried at the same time. And luckily, the way that everything was developed helped us to reach more people at the certain time where it was needed the most. Next slide, please. So the challenge, Guatemala, as you know, it's so small but so culturally diverse, where 22 languages are spoken. So developing a communication campaign in the right way to understand how the COVID-19 vaccine was perceived by the indigenous Maya population in the central highlands of Guatemala, since there's a lack of trust in the government since the Civil War, and determining which myths or misinformation existed within in the local communities, identifying sources of trusted sources of messages for indigenous communities members, and understanding how people prefer to receive the health information, including areas such as language, format, and platform. So these were challenges that we were facing when we were developing the project. Next slide, please. So our main lessons learned is that the development of information in the language of the community is imperative. Content should be culturally relevant, appropriate for low literacy populations, and should be in the languages that people prefer to speak. Research-informed interventions can increase activity effectiveness. Research has helped Bukukawa consider ways for more efficient and effective targeting of interventions, and trust is critical. Local healthcare workers and local councils were trusted sources of information. Understanding local dynamics around who is trusted and why can allow for a better targeting of resources. Technology and social media can be used to change behaviors, and community voices must be the front and center in dissemination activities. Next slide, please. So thank you. I know this was very short, but I think we highlighted the most important things. Thank you.
Thank you, Emily. Language is such an important aspect of working in this hyperlocal way. When you were speaking, Emily, I was reminded of something that Nelson Mandela said, that if you speak to someone in their native language, you speak to their heart, not only, intellectually in their head. Thank you for that. David, let me move over to you. Can social media be used to reduce health inequalities?
Great, thank you very much. And next, moving on to the next slide. So the International Longevity Centre in the UK is one of 16 ILCs across the world, and we're a think tank that looks into the impact of aging on society. And I suppose what we wanted to do with this project was, firstly, we know that older people from deprived areas and from Black communities in the UK are much less likely to get their routine vaccines. So we wanted to look at that. And then our hypothesis was, can you use younger people from those communities to get the message to older people via social media? And there are some really interesting examples. So AARP did a campaign where they got older people to do physical activity by using posters of weddings targeted at the grandfather, saying, because she deserves the second dance. There have been really interesting campaigns in Germany to encourage women to do physical activity by encouraging them to get their baby to do it. And there's the famous Thai campaign, and all of these which is anti-smoking. All of these are intergenerational, but very few have actually been properly evaluated. So we wanted to look at, can we make the case that you can use younger people to engage older and vice versa? So moving on to the next slide. So essentially what we did is we did some qualitative and quantitative work. We worked with an agency and a small charity to really try to understand, firstly, to create, ensure that our understanding was strong, so we could create some really strong advertising campaigns. So moving on to the next slide, essentially what we found was, we looked at pneumococcal, shingles and flu. For pneumococcal and shingles, the biggest barrier was that people didn't know they needed it, and for flu was a question around people not believing it was serious enough, not having time, and so on. We found that there was lots of evidence that came from our qualitative and quantitative work that said that helped us devise the advert. So, for example, what we found is people didn't want to be manipulated. Surprisingly, they liked the word jab in English. There were certain phrases. So moving on to the next slide, what we then did was we created adverts, and we created adverts that were trustworthy, conversational, open, family-oriented, warm. We used real people, not actors. So we used a small charity, and we put factual information. I should say, if you're ever going to do a campaign on vaccination and you're going to do it over 5 or 6 weeks, just be really careful about doing it over Christmas. And I'll come back to the comments we had over later. But it was really lovely, and the videos are all online. And so moving on to the next slide, for example, we as a result, we had huge, unprecedented engagement. We had 1 million people in the UK in specific communities who engaged with the adverts. 76% engaged with them, so not just looked at them, they clicked or commented. The click-through rate was 2.5 times higher, and we've got some analysis in the report that shows it would have been a cost-effective way to reach older people, both in deprived and from Black communities. So moving on to the next one. But actually the sad news from our hypothesis is actually we couldn't evidence that younger people shared it with older people. In fact, older people shared it more with their peers on Facebook. So I should say we used Facebook advertising and Instagram advertising. Most of the shares came from older audiences who shared themselves. However, when we did qualitative work alongside it, we found that younger audiences were clicking through to our landing page, and we think that older people did share the information offline. So we actually had, I think, about 200,000 people who saw the advert on Christmas Day, and of course younger people and older people in the UK would have been together on Christmas Day. So even if they didn't share it on social media, we think that there is some evidence they did talk about it. So moving to the next one. Last couple, clearly when you look at the comments, they weren't all positive. Really fascinating in terms of was that actually the vast majority of the reactions were positive, so the likes, but actually most of the comments were negative. But actually, as soon as anyone put a negative comment, someone else followed up with a "Don't be silly, that's nonsense." And actually, we think that the comments added to the engagement. So the fact there were lots of comments meant that we got lots of engagement. So last couple of slides, next one. So just final one actually. So I think what we think is that the campaigns are a really cost-effective and effective way to increase vaccination in poorer communities in the UK. One of the problems we've got, which is a really specific one, is that actually it is possible to book it was possible to book the COVID vaccine online, but not necessarily the flu and pneumococcal. So actually, clearly there are some barriers because we couldn't actually follow the process. So clearly, if people could click on and go and book their vaccine in a pharmacy, that would make an extraordinary amount of help. And in short, I think what we think we need to do is to really invest in some of these campaigns to understand how we can best do them. And I think we've proved the case that there is a strong case. We need to address the barriers, such as we need to make sure online systems for booking are right and where people go. And actually, we need to think about how we use social media data for public good. So one of the real challenges we had, just to finish, which is an interesting question, is it is not possible to target advertising at people based on their ethnicity. But of course, if we wanted to target people based on their ethnicity to deliver good public health. So there's really good reasons why that isn't possible. But I think there's an interesting question about how we can use data for public good. And at that point, I'll stop. But thank you very much for listening.
Interesting. We've had a perspective from Guatemala and the UK, and now I want to invite Sylvia and Al-Bashir to talk to us from the perspective of the work they've done in Algeria, Pakistan, Kenya, and Sri Lanka. And welcome to the Kenyans on the line. I see a lot of Kenyans in the chat group, and please feel free to chat to our panelists and ask them questions if you have questions. Sylvia?
Yes, hello, and hello everyone. Thank you for the introduction. I won't be able to cover all the countries, I'm afraid, because we have limited time. We worked in our project with 3 other partners. So I'm North Africa manager at Minority Rights Group, and I will speak about Algeria, and Al-Bashir will speak about the Kenya context. In the other countries, we looked at ethnic religious groups in Sri Lanka and religious minorities in Pakistan, and all this is referenced, of course, in the Insight report and also available on Minority Rights Group website. Our findings are the result of social media monitoring, especially Facebook, over a period of more than 12 months. So going more or less from January 2021 until March 2022, from the start of each country's vaccination rollout or campaign. Plus, we use different methods for triangulation, different in each context. I will now leave the floor to Al-Bashir, who will speak of Kenya, and then I'll move to Algeria.
Thank you very much, Sylvia. Stand by for Kenya. Why? I don't know why I struggled to put on this map here. You guys know Kenya. You know where Obama came from, right? Where the equator passed, and that's where we came from. And yeah, so thank you very much for joining. My name is Al-Bashir Mohammed. I am the president of Grand Synergy Development Initiative, which is a national NGO registered by the NGO Coordination Board. You can go to the next slide now that they know where Kenya is. Yes, we are also an organization member of Civil Society Reference Group, and it's good to mention this for the Kenyans who are in the house. I know you can remember us by what we used to do about the PBO Act commencement and all that. We're not very bad activists. This time we were doing something to do with health and on diversity impact on vaccine equality, a project which we were doing partnering with Minority Rights Group International, based in London. So we are part of their partners representing Kenya. So the project, there are so many publications out there. We'll share with you about the project and what exactly we were doing. But just to give you briefly of how we were using social media to basically understand the social media uptakes and confidence across religion, ethics, and geographic location. We were targeting majorly the minority communities and indigenous people. That includes the Muslims and indigenous people, the Aware, and some other communities living within the Kenyan territory. So the approach was quite different from different, research we used to do. This time we were basically using social media, and because 43% of population is using Facebook, we thought Facebook will be the best, social media to study from. And here we were using an application called CrowdTangle. I know most of you use it. Maybe you don't know that, but it was a tool we were using to collect more information and summarize them, and also analyze them so that we can be able to get exactly what we were looking for. But we also understand that majority of our population is in offline, meaning they cannot access, internet. And using Facebook or social media, that means you need to have a mobile phone. So we also introduced, we did a triangulation data methodology where 30 radio talk shows were conducted in different parts of Kenya. Radio talk show basically means radio broadcast, where you invite interested people, representative from Ministry of Health, and also community members to basically have a dialogue and discussion about the subject, which was basically COVID-19 vaccine. And so in order to understand, to get specifically what we're looking for, we had 4 indicators. That is, we were trying to understand the COVID-19 vaccine confidence and how much people have confidence in COVID-19. And reservation basically is what exactly people have in mind or believe. Like, for example, some people we are seeing in their comments, they were believing using COVID-19 is against their religion and all that. So this is basically the reservation about the vaccination and access to vaccine, whether it was supplied on time or if it's available, and distrust in health and government authority that is supplying the COVID-19. So using these indicators, we were able to get some result, which you can take in the next slide, please, as we finish. Yeah, so this is basically the key finding, and you can get more. We got, from the conversation we analyzed in Facebook and the radio talk show, we had 98% in Facebook versus 96% in radio talk show people communicating and discussing about confidence. And this shows also the data triangulation was very accurate because the difference is only 2%. And we also have 87% versus 90% of people also talking about your photo is hiding. Okay, just a minute. Yeah, Sylvia's photo is hiding information, but you can be able to see that. And the other issue is on trust in authority, which was 70% versus 57 compared to the Facebook results and the radio talk show. But all groups of the that we analyzed, they had issues about safety. So most of them were not ready to take vaccination because they fear for their safety. This trust in authority was very high, and I think this is something which we will also use as advocacy. That majority of the people in all the conversation across the Christian, Muslim, and the small population speaking in Somali, they do not trust the government when it comes to the dissemination of the vaccination. So because of time, I think this is just a brief of what we have been able to gather, and more information will be shared. There's a report coming in. There's also some bulletins from our finding that you can check out and see the result and how accurate it was. And thank you very much for your time.
Thank you, Al-Bashir. So we also looked in Algeria at the same sentiments that Al-Bashir just describes in terms of sentiments toward COVID-19 vaccination. About Algeria, I must quickly say that the government centralizes information in general and about also COVID-19 in particular, with the aim of allegedly limiting the spread of fake news. So there is only one governmental website that is the main source of information about COVID-19. And we found there were dramatically different levels of information shared in Tamazight, which is an official language, albeit one that was recognized only in 2016, compared to Arabic, which was always the official language, and French, which is not official, but it is widely used. In this map, I'm showing the different Amazigh population that are indigenous to North Africa. They are divided in different subgroups, which speak different varieties of Tamazight. In the focus group discussion that we used for triangulation, we looked at Kabyle, which are the blue on the coast, Shawi, which are the light blue violet, the border with Tunisia, and Mozambique, which are the brown at the center. We found difficulties in identifying Tamazight speakers on social media because the language is not widely used on social media for various reasons, including the fact that the speakers also speak Arabic and French. Also because names of Amazigh people are not always identifiable. Sometimes they share Arabic names. The locations are not always easy to identify. And so sometimes we had to rely on the content of the post and we had to do some manual analysis. Can we go to the next slide, please? As you can see from figure 1, actually only 15% of the Amazigh users used Tamazight on social media compared to 0% from the general population, but because of the reason that I just mentioned, there might be Amazigh people that we were not able to identify in what we classified as general. We found that there were much higher percentages of no confidence towards COVID-19 vaccination in Amazigh, so 28% against 18% of the general population. Next, please. And we also found that it was more common among Amazigh to have conspiracy-related fears in terms of reservation compared to the general population, whereas the general population had more doubts over vaccine safety. Maybe both low levels of confidence and spread of conspiracy theory were influenced by the lack of information in Tamazight. The research also revealed that distrust in political authorities was higher in all communities, and this is due to different reasons, like the fact that there's ongoing protests since 2019, crackdown on civil society, and so on. In the focus group discussion, distinctions was made actually from political authorities at the national level on the one hand, and local and medical authorities at the local level, with trust in the latter being reported as higher. And that was also the case in Pakistan and Sri Lanka. And in some southern areas of Algeria, the one that I showed in the map before that was in brown, there was some effective local government system that were established where local authorities shared information in the local variety of the language, and distrust in the authorities was much lower. Finally, most comments from Facebook did not contain reference to ease of or access to vaccines, except some concerns about information like in terms of language accessibility. So this is not really accessible, but from what we could infer, compared to other African settings in Algeria, vaccine confidence may be a more important barrier to vaccine uptake than access restrictions. And that's it from me. Thank you.
Thank you, Sylvia. And Asante Al-Bashir, there's some questions for you in the chat. I hope you can respond to those. Finally, we've got Oklahoma State University. Sky, your thoughts?
Oh, hi, everyone, and thank you so much for being here. And thank you to Insights Dialogues, Global Impact, and the Vaccine Confidence Fund for supporting this research and helping us make a positive impact in our community. Next slide, please. So our project is focused on Hispanic migrants in the US, as well as Hispanics from major migration countries of origin, like Guatemala, Honduras, El Salvador, and Mexico. And we chose to look at these populations for a number of reasons. The first is that these folks are typically underserved in respect to government and healthcare services in the US. The second is that they tend to rely heavily on social media for communication and information gathering as migrants in the US. Third, analysis and fact-checking services related to Hispanic social media groups and news pages are lacking in comparison to their English language counterparts. And finally, the transnational nature of social media communication across the study populations really offered a unique look at message proliferation in relation to COVID-19. So we deployed a mixed method approach for the study with interviews, qualitative and quantitative content analysis of social media posts, as well as AI-assisted data mining and computational analysis. The findings from these methods culminated in the creation of an experimental survey to test messages concerning vaccine confidence and uptake among Hispanics in the US. Next slide. So our project really boils down to one question. What aspects of social media messaging will make Hispanics in the US more confident in getting the COVID-19 vaccine? When you look at the Hispanic community social media posts, and when you talk with migrants about the information they have access to, you see and you hear a lot of disinformation and negativity concerning the vaccine. And the hard reality is that Hispanics have to sort through a lot of negativity about the vaccine to get quality information. What came through repeatedly was a need for quality scientific information presented to them by someone like them, someone who understood what resonated in the community, someone that could present the science and the upsides of the vaccine honestly. And so we mined and tailored pre-existing messages in Hispanic social media groups that were either positive about the vaccine and or promoted COVID-19 vaccine uptake. We looked for posts that were fact-based concerning COVID-19 vaccination. They had a high number of shares and likes in the community groups. And then we pitted those messages against very closely related generic health messages from the CDC and other health agencies. And what we found was that the culturally specific messages significantly increased COVID-19 vaccine confidence in contrast to the generic messaging. And that's above and beyond the effects of a variety of other controlled perceptions related to COVID-19 vaccination. So that's the most important finding of our study, the experimental validation that participants who were randomly assigned to culturally specific narratives were more likely to be confident in the vaccine. Next slide. We also adapted common themes in the interview findings and social media posts as culturally tailored persuasive message treatments. The most persuasive messages mentioned the vaccine as reducing health risk, their employers requiring the vaccine, vaccines providing protection beyond regular medicine, being able to return to normal social activities, and describing the effectiveness of the vaccine outright. Participants showed significant preferences for social media pages featuring Hispanics in the group's images as well. Next slide. There's also a significant interaction effect in the experiment. People who thought of themselves as susceptible to COVID-19 had greater confidence in vaccination, and this association becomes significantly stronger among those exposed to the culturally specific messages. Another thing to mention is that vaccine confidence was lowest among Hispanics exposed to generic messages with lower perceived susceptibility to the virus. Last slide. The overall takeaway from our work shows that with focused social media data mining, informed by the target population from interviews and interactions, you can quickly locate and build informative messages that enhance vaccine confidence, as well as build persuasive messages that increase the likelihood of vaccine uptake. All people want good quality information, but for communities that have limited access to government resources and official scientific information, intelligent social media mining and promotion of culturally resonant, accurate messages shows potential to balance the information landscape, and in this case, enhance vaccine confidence. There are some QR codes there that will show a project video that we shot. We're going to give you another rundown, and then there's also a QR code for our full report there. And I thank you for your time. Over.
Wonderful. I think excellent presentations from these numerous research projects that VCF funded around the use of social media to increase vaccine confidence. As we wrap up this panel segment, I just want to ask a question to David, Sylvia, and Sky. And Sky, I'll start with you since you were on last. Just one key learning from you that should be considered by other programs when leveraging social media. I'll go Sky, David, and then Sylvia. Just one learning from each.
Well, I think that the idea of boosting and promoting organic content that is already resonant in certain pocketed social media groups across a larger community of like-minded language speakers or culturally like-minded people is a really big takeaway. It's not that hard to do with just a little bit of knowledge of the groups. And the social media makes it easy to find those messages because people are already liking them and sharing them. And so, looking for those and promoting those is a really easy thing to do. If I can add one more, I'd also say that the predominance of negative comments that we saw in social media actually came from just a handful of users. A handful of people put out a lot of the negative content. I think that's something to be aware of and control. A lot of the negativity that people have to sort through is really just coming from a handful of bad actors, as it were. Over.
David?
For me, I think it's actually ties into that support, engagement, and conversations, not just broadcasting. I think if you're using social media just to broadcast, it's increasingly difficult to have the conversations. And I think I would say, don't be afraid of the negative comments, because actually I do think you can use those as a platform to point people towards other things, or frankly just ignore them. So I would just say, if you're going to get the most visibility, it's supporting the engagement and the conversations.
And Sylvia?
Yes. So I think, research on social media can be challenging in certain contexts due to different reasons, like internet penetration, use of social media, also security reasons. So I think what really worked well for us was having minority representatives in the team in general as a rule, but also because I think because of the necessary language skills to access the community for the focus group discussion, and especially when security concerns are high and you need to build trust and you need to provide context information. I think that was really important.
And just to kind of ask, this is a parting question, and I'll fill this to Emily and Channing. I haven't heard from Channing's voice since the beginning. And the question is really around what tools and resources are available or needed to expand the use of social media to drive vaccine confidence and uptake, as we think about broader implementation and learnings. Let me start with Channing and then Emily.
Yeah, I think you've seen here with these examples, people using Facebook advertising, advertising of all kinds on the internet. It's really important there. When in the study that we did for vaccine confidence across Nepal, Philippines, and Kenya, we used the same, and making sure that these platforms are easy to use, easy to understand, have already integrated the tools necessary for testing, is really critical. So the more that we can do to make those really dead simple for implementing partners to upload new information and to be able to trial different campaigns is one of the big investments I would continue to improve upon.
Great. Emily?
So I believe also thinking in a broad context, governmental and non-governmental alliances. So in between either way fan pages or the official social media that they're using. So in that way, we can increase our engagement with our audience. And also it's important to do like to have a qualified team that could translate the content in the different platforms for the languages that are needed. And also in our case, more coverage in rural areas and cost-effective of telecommunications. So the information that we're sharing is accessible for our population in the communities.
Great. Well, folks, time is always an issue when we're having great conversations like this one. Unfortunately, we'll have to kind of leave it here. And if you, the audience, if you have more questions for the panelists, please share them with us. And Jenna will speak to us as we close about where to send those questions, and our panelists will respond to those outside of this live event. So let me take an opportunity to thank our panelists for making time to have this conversation with us and share these insights from the work that they're doing that's covered by the VCF report. But before you go, there's one last bit of content that we want to share with you. Aisha Kasali from Meta is here with us to talk to us about VCF2. Aisha, floor is yours.
Thanks, Nko. Hi, everybody. It's really great to meet you and to listen to all of the amazing conversation that has been going on since the start of this session. I wanted to speak a little bit to our work, but first let me introduce myself. My name is Aisha Kasali, and I lead the Alliance for Advancing Health Online portfolio, which is an alliance that was started in June last year by Meta and Merck and some other global health funders. And our goal with the alliance has been to really advance understanding of how social media can be used to improve health outcomes globally. And the Vaccine Confidence Fund was the flagship program that we started with last year under this initiative. And we're really proud and excited about all of the results that has come out of this first phase of research. And as you can see, some of those have been shared earlier today. I think our goal has been to really continue to support these types of research to really drive collective understanding of how social media can improve health outcomes and impact global health communities around the world, and as well as equip global health stakeholders with the right tools and resources on how they can, incorporate the use of social media and behavior change communication into their programs. And so that's been our goal for this initiative. And we're very excited about the results that we got from the first phase. And so we're proud to announce that we will be launching a second phase of Vaccine Confidence Fund 2 to further deep dive into this area of how do you really use social media to drive vaccine confidence and vaccine uptake. And so the website and the portal is live. And so we would invite applications to this new RFP and for people to kind of submit and share their proposals on how we can further leverage social media. I think for this phase, I think some people might have the question like, why Vaccine Confidence Fund the second time? I think the initial gap that we identified with the first phase was that a lot of focus was on COVID-19, but then there's been a lot of impact in terms of how COVID has affected routine immunizations. And so we would like to better understand more around that area in this second phase. We're also placing an emphasis on, addressing vaccine hesitancy amongst healthcare workers and how to educate healthcare workers on addressing vaccine hesitancy with their clients and patients. And so that's going to be our focus and emphasis for the second phase. Our goal is to actually fund projects that really have an ability to impact real-world health outcomes. And we did have some of those from the first phase of the Vaccine Confidence Fund. But for this second phase, we really want to look at projects that actually have an impact on offline behavior change in terms of when you conduct all of these campaigns and studies online, how do we have that connection, end-to-end connection between online interventions and offline behavior change of people actually going to get the vaccine? And so, you know, like I said earlier, we're really focused on looking at how healthcare communities can be equipped to leverage social media for vaccine uptake. We're going to be looking at a bunch of interventions, not limited to chatbots on Facebook, on other platforms outside of the Facebook platforms as well. And our goal would be to kind of reach more high priority populations. I think another area that is actually very interesting for us would be, you know, looking at online health communities and groups and how do the social norms, our social norms interventions shaped or driven through online health communities. And so we're starting off on the second phase. I think the RFP is live and open for application. So feel free to go to the website. I think it was placed in the chat if you haven't seen that previously. You can go directly to read up more information about the RFP. For this phase, will be the awards will be on a rolling basis. So we encourage everyone to sort of like submit their applications on time. And please do share with your networks and so that we can have even more robust and diverse applications for this phase. All of the grant applications and awards would be managed with Global Impact. And I would like to take this opportunity to thank the team at Global Impact. They've done an amazing job in terms of just like working closely with the grantees and ensuring that, you know, all of these amazing results were delivered. So thanks to the Global Impact team and thanks to everyone for joining. Back to you.
Thank you, Aisha. Thank you so much. There's already questions coming through about the RFP. I'm sure some of those frequently asked questions will be addressed in the portal that you've shared. So what's left for me to do now is just to thank the panel again for making time to share your insights. I think there's a lot of learnings that came out of this conversation. So thank you to the panelists and thank you to the audience, especially the Kenyans. You're very engaged in the chat box. Asanteni sana. Over to you, Jenna, to close us off.
Thank you so much. Thank you to first everyone for joining today, and a special thank you to all of our speakers who shared all of their research and learnings today. We're excited to see the results from the Vaccine Confidence Fund projects. The slides and recording will be shared from today's session, but there's a lot more information available on these projects online as well. The final insights report is linked in the chat window, as you can see. You can also visit insightsdialogue.org. There are detailed research reports that have been uploaded to the microsite. You can also explore prior live events and podcasts that highlight some of these stories in further detail. Again, as Aisha had mentioned, we're also really looking forward to the second round, the VCF2, and seeing what further insights and learnings come out of that. So we encourage you all to take a look at the new RFP and think about what projects you'd like to submit and explore for that. As we close out today, just a quick note, please do visit insightsdialogue.org. There are over 150 different resources, research outcomes, evidence tools, and more that all look at this topic of leveraging social media to drive vaccine confidence. You can also join the learning group on Boost. This is a place where people can come together, learn about new resources when they're shared, get invited to upcoming events, and just stay in the know of what's happening in this space And then finally, just a reminder to please take our survey. We do want to hear from you and hear about your feedback from today's event and from what you've learned so that we can look at how we can shape future offerings to really best meet your needs and interests. And so the link will be in the chat and will pop up as you close. So again, just a huge thank you to everyone who has joined. We will be taking a look at all of the questions that have been shared in the chat and make sure we get responses back to you all following this event as well. And we hope you all have a wonderful rest of your day and can take some of these learnings and apply it to your own work. So thank you.